Hello everyone, in this video we will talk about the fungus Pneumocystis jiroveci. So Pneumocystis jiroveci is a fungal infection and it is considered a fungus because of the presence of chitin and beta-1,3-D glucan in the cell wall. So because of these two, chitin and beta-1,3-D glucan which are present in the cell wall, it is considered a fungus. But the properties that make it different from a fungus are that it does not have ergosterol in the cell membrane. So ergosterol is absent in the cell membrane, and also it does not exist in a mold or yeast form. So the way you have fungi and they exist in the yeast form or in the mold form or both, Pneumocystis jiroveci does not have a mold or a yeast form. The forms that it does exist in are the trophozoite, precyst and cyst. So these are the main features of the fungus Pneumocystis jiroveci. Presence of chitin and beta-1,3-D glucan in the cell wall, but absence of ergosterol, and it does not exist in the mold and yeast form. It exists in trophozoite, precyst and cyst form. Now if we look at the pathogenesis, it is ubiquitous. It is ubiquitously present in the environment and it is present in the respiratory tract. Mode of infection is by inhalation and the risk factors are HIV, immunocompromised and transplant patients. So this infection happens more in immunocompromised, HIV and transplant. In an immunocompetent patient, the infection will be asymptomatic, so there will be no development of symptoms. Whereas in immunodeficient people, the disease that develops is a bilateral interstitial pneumonia. So it is an interstitial pneumonia where the chest X-ray will show infiltrates. Now the characteristic sign of these infiltrates is that they start perihilar, which is surrounding the hyla of the lungs, and they spread peripherally. So they start perihilar, which is around the hyla of the lungs, and they spread peripherally throughout the lung. That is the characteristic feature of the infiltrates which are seen in Pneumocystis jiroveci infection. For the diagnosis, the sample that we take is a bronchoalveolar lavage. Now when we do the microscopy of this sample, we can see both trophozoite form and cyst form. Trophozoite form is seen when the specimen is stained with the Giemsa stain, and the cyst form is seen when the specimen is stained with a Gomori methenamine silver stain. Now the particular characteristic feature of the cyst form is that it appears as a crushed ping pong ball appearance. So that is what we see, or it can also be called a crescentic appearance. So the cyst will be seen as a crushed ping pong ball appearance with Gomori methenamine silver stain. One very important feature of Pneumocystis jiroveci is that it is not cultivable on any culture media. So culture is not going to be of any use. And we can also do a nucleic acid amplification test. The treatment is by giving cotrimoxazole.